From the beginning of time, humans have sought healing through ritual, prayer, and nature's remedies. Over thousands of years, formal systems of healthcare have emerged, rooted in foods, herbs, and other natural treatments. These systems continue to exist alongside what we now call Western medicine, which has made tremendous strides in conquering infections and advancing surgical techniques. But medicine is more than just doctors and hospitals. That's exactly what we will explore this week on A Better Way to Health. Meet your host, Dr. Stuart Shipe, a registered pharmacist, acupuncture physician, and Chinese herbalist. He's not here to judge or persuade, but simply to invite you to explore the idea that good medicine comes in many forms. So let's get started.
I guess the very first time we get on the show here, it's really all about trying to get your questions answered to the best of my ability in proposing what are some really common questions with acupuncture. So we'll jump right into some of the topics. I'm Dr. Stuart Shipe, an acupuncture physician, registered pharmacist, herbalist, and we have a natural medical practice that I see a lot of people with a lot of issues. And a lot of that boils down to, if you go to a Western doctor and you go to a gastroenterologist, you know what kind of to expect, or a cardiologist or an ophthalmologist. But when you say acupuncture, there's a lot of misconception and a lot of questions around that. What is this? What does it help with? And can it help me specifically is pretty much the most important question. So what conditions can acupuncture help treat is the very first generalized questions. And we have to back up a little bit and give you a little bit of history before I jump right in, because the common answer that I would have for individuals when they say, does acupuncture treat X, Y, or Z as far as a Western disease name, diagnostic name? And I will always say no. So does acupuncture treat hypertension? No. Does it treat diabetes? No. Does it treat cancer? No. Because we don't treat the disease name. That's a Western paradigm. They have specific therapies, including drugs or surgery or therapy that address that diagnosis name. But in Chinese medicine, it really doesn't differentiate out the treatment per the Western disease name. And one of the reasons why is because we're more of a holistic thought process as a medicine. We're a preventative care practice rather than a reactive care practice, not only treating symptoms, but certainly looking for the root cause of disease. Traditional Chinese medicine, its philosophy, we always said, Bun Biao. What does that mean in Chinese? It means the branch and the root of a tree. You can continue to treat the branches all day long, but until you really treat the root of the tree, nourish the body, support the body, and find that underlying foundational problem, you're going to be treating that body in relief care forever and ever and ever, which is kind of the philosophy in Western medicine. As long as you don't have symptoms, you must be healthy, right? 2,500 years ago in Chinese medicine, the most consecutive documented medical records in the entire world are Chinese medical documents. And we've seen diseases like hypertension and cancers and blood sugar problems like diabetes would have it today. And we had specific treatments. So people said, wow, you can really treat this type of a disease modality. And I was like, yeah, it's kind of a human problem that has been going on for many centuries. And so that gives us a little bit of relief that even if we don't know the name to a disease, the Western name to the disease, we still can treat it. And it's because of the philosophy, the medical philosophy of the diagnostics and the workup of a patient that we're trying to find that syndrome. You ever remember when you were in grade school about finding that common denominator, right? That was always something that was, a miss to a lot of students. They're like, I can't catch the concept of that. But that's exactly what Chinese medicine looks at. It looks at what is the foundational weakness, and then the symptoms that you experience, whether it's high blood pressure or higher blood sugar, are the result of a malfunctioning problem in the body, an underlying problem. And so once you address that underlying issue, the symptoms go away and the symptoms will improve fairly rapidly. Kind of think of acupuncture like a garden hose, trying to water a garden with a kink in the garden hose. that's not probably going to go well for the garden after a while because it doesn't get that nourishment. It doesn't get that vital life force that it needs to grow and be productive. So an acupuncturist would just help try to determine where's the kink in the hose, release the kink that releases that life-giving energy in the body to heal as it should be healed. The body knows how to heal itself already. If you get a cut and you wash the cut a little bit, your cut will heal. And it's the same way with any type of modality, any type of condition based in Chinese medicine, is all about this circulation of blood and circulation of energy. Any kind of blockage or stagnation in the flow of that blood in the body or in the flow of that energy, the Chinese always term that qi, Q spelled Qi or Chi, you have this malfunction starting to occur because the blood is stuck, not moving, the qi, the energy is stuck, and ultimately the organs end up suffering. So the misconception, like I said, in America is that health is the absence of symptoms. But I want to tell you that it's a very, very wide space, a huge space between health and death. There's a huge space that means that if we're not healthy, we start off going down a path of malfunction that'll start giving us symptoms occasionally. And if we don't treat that, then the symptoms start coming on all the time, more routinely. And if we don't treat that, it gets to a really bad place where we need really significant intervention like surgery or other therapies or toxic. I would call many drugs are toxic. We need pharmaceutical intervention. And if we don't treat it there, then the patient gets closer and closer to expiring. So I know that's kind of like an anathema for a lot of people. They don't understand that because I was like, oh, I feel healthy. And I talked to a lot of patients that say that. And I was like, yeah, but you're on this drug and this drug and this drug. And so stop the medication then. And they're like, oh, no, I can't do that. And I was like, then why? It's like, well, the problem would come back. I was like, then you're not ultimately healthy, are you? There's a whole different perception of what is health, what is the criteria of health. Acupuncture, a lot of patients come to acupuncture for pain management, and there is absolutely great results with that, well documented in the literature. We have things like lower back pain. Actually, Medicare, a couple of years ago now, has approved acupuncture for the treatment of lower back pain. And there's a lot of caveats to that, folks. So that means that you got to jump through a lot of hoops, and there's other information that I'd have to share. But just generally, a lot of insurance companies are starting to pick up the treatment of acupuncture for these specific type of defined diseases or imbalances. Why low back pain? Well, because a lot of individuals, especially our seniors, are suffering with this. We have a pandemic about drug use, treating patients in chronic pain with opiates. So there had to have been another solution, and Congress said, hey, what about acupuncture? Why did they pick acupuncture? It's because of the clinical studies. There's a lot of great studies coming out that show that on comparative, not does acupuncture work, but what's the comparative analysis between if I use acupuncture to treat lower back pain, or I use surgery to treat lower back pain, or I use conservative therapy like anti-inflammatories or pain medications, which one gives me the best outcome and which one is the best as far as efficacy with dollars, right? Which one costs the least to the supplier, which is the insurance company that's supplying the treatment, right? And of course, any insurance company is going to want to make money, and they're going to select the one that provides the best outcome with the best cost analysis tied to it. And we have great studies for lower back pain, for knee pain, for joint pain that actually far exceed the outcomes and the expenses of a lot of Western interventions. Now, I'm not saying that those aren't necessary, because by the time you wait too long, and whether it's a nerve or whether it's a joint or whether you have bone on bone, it's very difficult. And thank goodness we've got great diagnostics and we've got great surgeons, but it shouldn't be the first option. The Chinese have always said, why wait to forge weapons when the battle's already done? Why dig a well when you're already thirsty? What they're saying is that it's too late. It's better to treat these disorders very, very quickly before they get out of hand. Digestion is another huge one that we see in Chinese medicine, works very, very well with acupuncture. Why? You don't have to put anything down the mouth to fix it. We're talking things like irritable bowel syndrome and acid reflux, and people being on stomach ache and And intestinal inflammation, they would call that SIBO, or maybe you have an inflammatory bowel disorder, Crohn's or ulcerative colitis or diverticulitis. These are all nasty, not in the fact that that's attacking the digestive system, but the fact that it's interfering in absorption of nutrients. If you've got so much inflammation in the gut, you can put the best herbs, the best food down the mouth, the best supplements, but it doesn't mean that your body's going to get it. If the digestive system is inflamed, that whole absorption mechanism is really messed up. And I see a lot of that in patients that heal very, very quickly, that come in as a disaster. And I was like, if you've been on this stomach medication for X amount of years, you have to recognize that although it does help initially, there's an evil side sometimes to medications called adverse side effects or drug reactions and adverse reactions. And some of those medications have been shown to maybe enhance the likelihood of osteoporosis or other types of disorders because you're disrupting the natural flow, the natural acid secretions in the stomach that are necessary for minerals to be ionized or absorbed into the body. So that gets really deep into the treatment, so many digestive disorders. The other thing is stress. Holy cow. We're going to talk about that in another podcast, but when you look at stress generally, the general pattern, it's fatigue and tiredness, headaches, neck and shoulder pain or lower back pain, allergies, insomnia, digestive problems, right? Hormonal imbalance, the list goes on and on. It's because our body is under attack, not from any kind of pollution, not from any type of external trauma. It's under attack from our lifestyle. And that's, I think, the best thing that Chinese medicine tends to work at is, can you help this patient modify their lifestyle, look at their nutritional status, look at their movement patterns, and then make a comprehensive plan for them that includes all of these. Have the patient be a partner in their care. I love being on a journey with the patient in their healing journey. That's what I always tell them. I was like, this is all about you. And this isn't about me. I'm just here to be your Olympic athletic coach. And you're the athlete. You want to run the race, and we're going to do it together. And that's how I really find that acupuncture really works well, is when I'm teaching, Lao Shu, my name is teacher, when I'm teaching the patient, what is their body trying to tell them? And then, of course, through natural means, how can we help support that body's natural ability to bring balance back without causing more problems? See, there's no such thing in Chinese medicine as the advantage of treatment versus the non-advantage of treatment. In pharmacy, even though we used to say things like, does the benefit outweigh the risk? And in Chinese medicine, we would never take any risk. That's not even a thought in a doctor's mind, because even the most toxic herbal medicine will just make you sick, maybe nauseous or throw up. But man, not give you like 156,000 people. I think the latest result was of people dying from GI bleeding from taking pain medications over a long period of time. So these are all different disease states. We talk neurology and respiratory health and addiction. Smoking addiction is huge in Chinese medicine to try and help these folks recover from that. A big thing is chronic fatigue as well. Chronic fatigue and energy levels, it can boost both with acupuncture treatments. And then we use ancillary herbal medicines. We can use Chinese herbal medicines. We can use exercise therapies like Tai Chi or Qigong and try and help that person recover faster by using multiple types of therapies that are all supportive. And lastly, for the ladies and sometimes for guys too, with testosterone is hormonal imbalances. Oh my gosh, the ladies coming in either with menstrual irregularities, we will help them figure out what's a healthy menstrual cycle and how to get there. And also the ladies that have ceased their menstrual cycle is, how do you combat the hot flashes, the night sweats, and the irritability and loss of libido and all of that craziness? Ultimately, fertility as well. I didn't even mention that as far as hormonal imbalances. Many, many young ladies today coming down with infertility issues. So these are all conditions, but in Western medicine, but in Chinese medicine, they're all dealt individually. And once you do that, you get the best result. I hope that answers that question for you today. It's been a pleasure spending some time with you. Consider the use of traditional Chinese medicine and get it checked out. A consultation is the very first best way to begin so that we know if acupuncture and traditional Chinese medicine might be the right fix for you. Dr. Stuart Shipe, thank you very much.
Thanks for listening to A Better Way to Health. Discover health, wellness, and healing by booking your consultation with Dr. Shipe. Call 772-398-4550 or book online at traditionalchinesehealing.com.